Relationship-based care is really the foundation of all of our practice, not just in nursing, but in medicine. We look at the whole patient. The patient comes to us as a whole human being with a family, with a life. As cancer therapies change, of course, our practice must change. And over the past 6 years, we have really developed the role of the oncology nurse navigator. That individual is really sort of the touchstone, the rock that the family can keep going back to. It's all, again, about that relationship, knowing that patient, knowing that family, understanding what their treatment course is going to be, and being available to answer the questions and help guide the patient's care so that they are feeling as well as and optimizing their health as much as possible through treatment.
Patients and family members are decision makers, they are partners in the care they receive and the care that we provide. And from deciding what buildings should look like, the setup, whether phlebotomy should be centralized or decentralized, what medication labels should look like on bottles to ensure privacy but also readability, to how many locations we should have. The number of ways in which patients have impacted the decisions that we've made within the organization are countless, and we've done things right the first time because of their involvement.
The goal will be wherever you touch the Dana-Farber, right? Wherever you touch the Dana-Farber, we should have a process to make sure that the clinical access is easy. And whether that's in Foxborough or up in Merrimack Valley, right, where we have a different patient population, or even in our Brighton site where we have a different mix of patient populations there, we want to make sure that the access to Dana-Farber isn't just for a specific type of patient. It's really for all of our patients.
Now, 95+% of oncology is delivered in an ambulatory setting. We now have supportive therapy so that the risk of infection, the risk of bleeding, the side effects of treatment, nausea, et cetera, are incredibly well controlled. And that's really allowed us to move the treatment of patients out of the hospital and into the clinic. And now our therapies, we have more and more oral therapies, which allows patients to just stay in their homes and go to work and lead normal lives rather than spending 3 or 4 or 5 days out of every 3 weeks in the hospital.
I see what's been done over my 30 years, and it blows me away with how much things have changed for the better. And then again, how much things have stayed the same, how much the compassion and the hope and the strength of our patients and families have just stayed the course. And that has been a joy to watch.